Hey everybody, Kara Castanova from Lindell TV here in the Senate Rotunda. I am with Brianne Dressen. She is the founder or the co-founder of React 19, an organization that advocates for the vaccine injured, which is great. And thank you for doing that, Brianne. Welcome.
Thanks for having me.
So I know that you're here today to meet with Senator Johnson. We're here in the Senate building, and you had a very important meeting with Senator Johnson, who really is the only senator right now, well, one of the only that is actually trying to hold these vaccine companies accountable and keep the conversation alive about the damage that was done by the COVID-19 vaccine. Why is that important? And maybe you could start off telling us a little bit about yourself and then why you're here today to meet with Senator Johnson.
Okay, well, from the beginning, in the beginning of the pandemic, I was a healthy mother of 2 young kids. I had a small business, and I was really worried when the virus outbreak happened. And I just wanted to do my part to help get us all out of the pandemic. At the time, I was a true blue registered Democrat, and so I wanted to do my part to help my fellow man, right? I had little kids in my preschool that were mandated to wear masks, and little 3 and 4-year-olds wearing masks is not going to work. And it never worked. And so I wanted to make their lives get back to normal as soon as possible. They were very stressed by all of the different regulations and rules that were coming out that was severely impacting these little kids that we were working with. So I enrolled in the clinical trial with AstraZeneca here in the United States. And I got
AstraZeneca is the name of the vaccine. That's I guess a less popular one. I've heard of the Johnson & Johnson and others, the Moderna, but that one is, and we'll talk about that a little more because of you, now banned in the United States. But
yeah,
continue, please.
Because of my injury, we reported my injury to the federal authorities. 9 days later, they pulled it off the market.
Wow.
So there was enough problems that the government did pull that one before it even had an ability to hit the public. So, but November 4th, 2020, I got my one and only shot, and my reaction started within an hour. I had severe tingling down the same arm as my injection, just tingling and burning, kind of like what it feels like when a limb falls asleep and it's numb and it's heavy. But there was no reason for my arm to have any, circulatory issues. Then that prickling, burning, tingling moved to my other arm, and then it moved to my legs and actually up to my head. And to this day, I still have that horrific prickling, burning, tingling sensation all over my body, 24 hours a day, 7 days a week to this day. So 5.5 years later. So could it be caused by the vaccine? It's very clear to me, yes, because there's nothing.
Well, it happened an hour after. And
yeah, I was so totally healthy before.
And it's neuropathy,
yeah.
And that's not common, I don't think, for someone your age, especially an hour after getting a vaccine.
Correct.
And your body started tingling. What was going through your head when it started tingling? Did you know right away that it was a vaccine injury, or did you just think it might be something else?
Oh, I knew for sure it was due to the vaccine. I mean, there is nothing else I've ever experienced in my life that even came close to that, right? So severe vision changes, sound sensitivity hit after that. Dramatic weight loss, vision sensitivity.
That's scary.
So double vision. So that night I was watching TV with my husband after we put the kids to bed, and instead of 1 TV, there were 2. And I was like, that's
oh my God,
right.
so scary.
Yeah. So, and then I lost movement in my legs. I lost control of my bladder. Before I knew it, every single system in my body had been impacted, and I landed in the hospital. And the drug company actually called and unblinded me in the hospital, confirmed that it was the vaccine, not the placebo. And they said, because of your adverse event, we're recommending that you not get the second dose.
When was the second dose supposed to come?
It was supposed to come like a week after my hospital.
What do you think would have happened if you got
it? Would have killed me.
Yeah, I would finish the job, I guess.
Yeah.
Scary. I'm sorry that happened to you. So the vaccine, the government decided after that, this came after your lawsuit, I'm assuming. Well, let's go back to just kind of reliving what happened. So your body started numbing up, and did it get worse? And has it?
Yes, it got worse. It got so bad that I couldn't sleep. I couldn't think about anything other than just trying to breathe through the horrific, painful sensations going through my body. I couldn't eat. So I was literally holed up in my room by myself. My husband's pants, as he walked into the room, the swishing of his pants was too much for my ears. My dog's panting was too much for my ears. So I was removed from my 2 kids. They were 6 and 8 at the time. I was removed from my career. My career is done.
There's a name of that when you're sensitive to sound. What is it called?
Hyperacusis.
And it's really
It was wild. So it's kind of like if you're at a sporting event and someone lets off a bullhorn right next to your ear, and your body has that immediate response to get away from the sound. That's what it's like from a dog breathing, your husband walking, running water. I mean, it's a very strange thing, but what it really is it indicates that there's something inflamed in your brain and in your auditory nerves. And so when your brain is inflamed and swelling, you're going to have all kinds of problems, and none of them are good, right? And so we're still dealing with several of those problems to this day, but the sensitivity to light and sound has resolved. Everything else I've been fighting and trying to gain back. Like right now, my legs are numb. So I look fine, but behind
it must
the
be
scenes,
make it hard working out then and actually
everything has changed. My career is over.
What did you do
relationships
for
are
work?
done.
What was your job before?
So I was a preschool teacher. I owned my own preschool. So yeah, it changed everything. But because I was one of the first injured, because it was the clinical trials, I essentially became ground zero for people that were harmed. So after me, I was hoping I was 1 in a million. I really did. I was like, I hope that this is not something that's systemic. But when the public rollout of Pfizer and Moderna happened, then people started popping up online having the exact same issues as I
So
had.
neuropathy. Did you meet anyone else that had the vaccine that you had have similar?
Yeah, so AstraZeneca, Moderna, Pfizer,
A lot of
J&J,
people got neuropathy.
all of them, neuropathic symptoms, leg weakness, GI issues, brain fog, sensitivity to light and sound, rashes, heart issues, chest pain. It's not brand specific.
And what ingredients do you think it is in there that causes that reaction?
So I really do suspect that there's a couple of things. mRNA obviously is very inflammatory. The lipid nanoparticles really do cause a systemic inflammatory and allergic response in the body that just that in itself can cause major problems in the body, right? But beyond that, the spike protein being generated in your body, which all 4 of them are designed to deliver the code into every tiny cell anywhere in your body, in your brain, spinal cord, heart tissue, GI tissue, reproductive organs, skin nerves, right? The spike protein, when you're infected by the virus, does not go into all of these cells. But when it's injected and the code is inserted everywhere, then the spike is generated in these places that typically it doesn't have access to. And when that happens, you're going to end up with your brain swelling. You're going to end up with systemic brain damage. You're going to end up with nerves all over your body tingling and burning and being damaged, right? These vaccines are designed to deliver a neurotoxic agent into specific parts of your body that would never have received those to begin with. The body is not designed to have those pathogens in those places. And that leads to permanent damage in people that we represent at React 19. 40,000 people that are harmed here in the United States that we represent every day.
49,000 people. 40,000. 40,000 is a lot. And I know there's way more than that, obviously. So you mentioned earlier as part of your story that you were a Democrat. For some reason, I don't know why the chips fell that way. It was Democrats that were more anxious to get this vaccination. It's really what pushed me. It was the final straw for me. I had already moved away from the Democrat Party a couple of years before, but 4 years before the whole COVID pandemic. But yes, that is what severed ties for good with me. I don't think I could ever forgive them for what they did with the forced vaccines, with the guilt tripping of the American people, with the fear mongering. Like that will never be forgiven in my point of view. Is that the reason you've left the party predominantly?
Yeah. I mean, the reason I was part of the Democrat Party is because I was a preschool teacher. I was like, just over the top into compassion and love and acceptance, right? And then when push came to shove, the Democrat Party is not that, right? On the surface, it feels that way. But when it comes down to it, if you don't fit into their perfect box, you're out. And I'm a sad, result of that. Every day I can tell you, they left me for dead.
Right.
That, all these people that told me to line up and get my shot, I was their front of the line person. I did exactly what they said. I did the social distancing, the masking, everything, right? And then when their vaccine entered my body and destroyed my life, they were nowhere to be found.
Right. And it even, I guess, worse than nowhere to be found, they started demonizing the vaccine injured and really canceling,
Yep.
removing you from society. That's what they tried to do with people that were speaking out against the vaccine and anybody that was injured by it. So you have since then started your organization, React 19. Could you tell us more about your organization?
Yeah, so we're a 501c3 registered nonprofit here in the United States. Like I said, we have 40,000 members that have been harmed by the COVID vaccines. We also have partnerships internationally with 20 other organizations globally that are all the same. They've been started by the injured for the injured. We have awarded $1.9 million to date to people for out-of-pocket medical expenses to help them on their recovery journey after their COVID vaccine injury. We've been able to get kids out of wheelchairs. We've been able to get, literally children removed from psych wards and to proper doctors that can get them help so they can then go back to school and start resuming their lives. Been able to get fathers who have been able to work for 3 years, who've been trapped in their homes and in their beds, back to being able to do some kind of work and be able to have some quality of life with their kids. We're not curing people, but what we're doing is we are giving them some element of their life back, which is a huge, like the people that
And
we
also
help are-
validation.
Yes, it's incredibly validating for them. We see them as a human instead of you're anti-vax, this is ridiculous. Like we're able to transform these lives one by one by one. But the reason why we started React 19 is because the government isn't doing their job, right? They do have a compensation program that's supposed to be working, has a 98.5% rejection rate. There's 15,000 people currently in the queue waiting for their inevitable rejection, right? They're supposed to be communicating adverse events and acknowledging adverse events and letting the medical community know what these shots can and cannot do, which they're not doing. So because they're not doing their jobs, that's why React 19 exists.
What is the remedy for somebody that's vaccine injured? What are some of the therapies available?
We have a medical board with, board certified neurologists, immunologists, stellar team. It's headed by Dr. Mobeen Syed. And you can actually see some of his videos on YouTube. His medical lectures were pretty famous during the COVID era.
Is it mostly holistic stuff, or is there any?
So
Is there an antidote to the vaccine? I guess is what I'm trying to.
There really isn't. If you're genetically predisposed to having a severe reaction, you can minimize the damage by having early intervention, protocols that a lot of times is a boatload of antihistamines and steroids. But the real preventative measure is to probably just not get it in the first place. These medical experts have told us time and time again that this is the most complicated medical condition that they have ever had to treat in their entire careers. And so for us to think that we're going to take the most complicated medical condition that is not being researched, there's no funding looking into any type of really good protocols in a clinical trial. It's crazy. It's not happening, right? So there's everything from steroids to antihistamines to diet change, helping you sleep better, all the way to the very aggressive therapy that I first got actually at NIH headquarters in a study in 2021 that was IVIG, which cost $20,000 a dose. And I have to get it every 2 weeks for the rest of my life. And it's got a high rate of possibility of stroke and cancer and all kinds of stuff. But compared to where I was where I was going to die and I was completely bedbound and wasting away. I'll take the risk with this other drug.
Right.
But so it's a catch-22, really complicated. But React 19, our medical board, is going to be releasing some protocols very soon in the next month to look into how to treat this.
What is one of the worst injuries you've seen besides your own?
The worst injury, so the very worst injury, in addition to institutional malfeasance that I have seen, has actually been with injured clinical trial participant Maddie DeGarry. She's an injured 12-year-old, totally healthy kid, cartwheels, soccer, like her whole life was ahead of her. She participated in the clinical trial in Ohio for Pfizer, and her reaction started after her second shot. She felt like it felt like someone was pulling her spine out or heart out through her neck. So that's a neuropathic, a neurology.
Her heart out through her neck?
Yeah. So her nerves were being attacked within her spine. And then her legs stopped working and she was incontinent. She could no longer go to the bathroom. She had extreme weight loss, 7 seizures a day. Okay.
And she had no medical problems before that?
No medical problems whatsoever before that. So
how soon after the vaccine did those start?
Within days. It's
insane.
Within, I want to say it was either 2 days or 5 days. But with our membership, 50% of all the people that are in our membership, 50% of those symptoms for people started within 24 hours of their first shot. 75% started within the first 5 days. So we're not talking about magic symptoms that are popping up out of nowhere. Like, it's very clear for people, at least on the timeline, what's happening, and they can associate it pretty well. So with Maddie, her information was not coded correctly in the clinical trial report. It shows that she had
She was in a clinical trial?
In the clinical trial.
So a parent volunteered a 12-year-old for a clinical trial.
Yeah, but she also was just like me. She just figured it was.
But it's a child. If you want to volunteer an 18 and over person, I understand that. I'm not judging somebody. Like, if your decision as an adult,
yeah,
to volunteer your 12-year-old child for a clinical study.
Yeah, but if you think about it, these were safe and effective already, right? So, and that's the reason why I signed up for it too.
Why would it need a clinical trial if it was?
Because we just sat there and we were like, well, we're going to get it. It's phase 3, which means that if there were dangerous things.
So phase 3, what does that mean? That means
2.
It's about to hit the market?
Yeah. And
they tested on a number of other people. How many people?
Yes.
How many people were tested? The vaccine you got, what was it called?
There was about 50,000.
50,000. They claim.
But
were some of those placebos? Half of them placebos?
Half of them are placebos.
So 25,000 actually received the actual injection.
Yep. And then there's a subset that have adverse events. And what we've learned through the clinical trial process is.
Did they release the information to you later? Like the first 2 phases of the clinical trial, were there injuries that they didn't disclose?
They were supposed to disclose those and they didn't. So that's also part of my lawsuit against AstraZeneca. But yeah, so with her case, they coded her as functional abdominal pain. And I don't know any kid that has a tummy ache that can't walk, is permanently in a wheelchair, and is permanently incontinent, right? So they misrepresented the data to the public to then mandate all of these other kids to get the shot.
How old is she now?
She just turned 18.
So wait, they used the information. How could they use adverse information to get other kids to take it? It's so evil.
Because they watered down her injury, because there were 1,200 something kids in this trial. So 1 in 1,200, one severe injury out of 1,200 is going to block the entire Pfizer vaccine rollout for all kids. So all they have to do is water down the injury and be like, oh, she just has a tummy ache.
Is she available for interviews via Zoom? I would love to talk to her. She's 18 now.
Yeah, so she's done with public interviews and stuff, but she has done several roundtables with Senator Ron Johnson in the past.
Right.
We kind of linked up at the very beginning of this, and we've been pushing ever since, but she's focusing very, very hard on her recovery right now. And believe it or not, when people are illness and dealing with a complex chronic illness, that in and of itself is a full-time job. And so we're
getting better. Is she still incontinent?
That part's getting a little bit better. There's a lot of things that have gotten worse. No,
she's still in a wheelchair?
Yeah. Like it's a terrible, catastrophic injury. Every single person in this country should know what happened to this kid.
has doctors diagnosed her with anything other
Yeah,
than
yeah.
vaccine injury? What?
Yeah, so she's been diagnosed with CIDP,
What is
which is a
that?
chronic inflammatory demyelinating neuropathy. So basically, her nerves are being attacked all the time, which is very, very similar to what I have.
And her doctors that say she has this, do they say it's from the vaccine or just it popped up on its
She
own?
does now because of the network at React 19. We
Right.
have got her in with the right doctors that do acknowledge fully with what's going
But
on.
before that, when they diagnosed her with neuropathy, what were they saying it was from?
They gaslit her.
They were just saying, "Oh, it's genetic," or it's.
There is only one explanation for neuropathy in a child, and it's usually diabetes. So before the COVID era, neuropathy was not something that young, healthy women had. It was also something that kids do not have unless they have a severe form of of diabetes. So these are things that are, like a stroke and a heart attack. We hear about this from the COVID vaccines. You go into the ER, it's right there on your x-ray, right? Like they can find the clots. It's very clear.
Welcome to Vocal, the free speech social app that gives you a platform to amplify your voice. Speak freely, connect boldly, and be part of a growing movement for truth, faith, and freedom. Want to know what's happening right now? The Now Playing feature shows you exactly who's live and what's streaming in real time. Check out the show's feed, a non-stop lineup including Lindell TV News 24/7, shows and on-demand programming all in one place. Connect with your favorite host and never miss a show. Explore the featured page for quick access to Lindell TV's top shows. Follow your favorites and watch their newest content flow right into your feed. And when they go live on Vocal, you can join the live chat and be part of the action. Ask questions, share your thoughts, even help shape future shows. Stay informed on issues around securing our elections by following your state's Cause of America account. Join a group and connect on a deeper level, from faith and freedom to the future of our nation. Go to vocal.com or download the app today and be a part of the mission to save our country.
When it comes to neuropathies, it's veiled in all kinds of different tests, and it's hard for doctors to identify it, even if you are a diabetic, and it's very open and shut case. ERs are not equipped to identify these types of serious conditions. But when you're vaccinating the entire population and mandating the entire population, you better have your medical teams all over the country equipped with the right protocols to identify these when these people land in the ER.
Right.
Now, what's crazy is the National Institutes of Health. They flew us out early January of 2021, or in early 2021, beginning in January, March, and June of 2021, we were being flown out to be evaluated and treated at the NIH. The NIH knew then, and they know now, how to treat these COVID vaccine injuries. All they needed to do was take the information they collected from us and release that information to the medical professionals. And that's one of the things I was talking to Senator Johnson today about.
Before we talk about your meeting with Senator Johnson, let's talk about your lawsuit really quick. So you have a lawsuit, and most people are aware that these vaccine companies have immunity, and so does the government, and so does any individuals, that should not have any type of immunity. They do, though. If you're vaccine injured, you cannot sue.
Right.
But you're suing. You're taking a different route. Can you tell us about your lawsuit?
Yeah, so my lawsuit is different because I'm suing for contract violation. It actually doesn't have anything to do with my injury. So because the drug company and I made a written agreement that they have agreed to do certain things in case of an adverse event to the trial medication. They're supposed to help medically and financially if there's a problem, and they did neither. As soon as I was injured, it's as though the drug company couldn't get away from me fast enough, right? Like my husband was calling them because I was just trying to survive. He was calling them
And this is in
multiple times a
2020?
week. Yeah. And he was like, please help my wife. Has the drug company gotten back to you? Please help us. Because there's a testing site that's like the middleman. And they're like, they're supposed to be reaching out to you any day. You should hear from them any day now. There's a lead team of neurologists at Oxford, and they're supposed to be calling you. No calls, no follow-up, no monitoring happened. So they grossly violated their contract and they left me for dead, which is a big, ethically even, that's something that should not happen. But I heard from them twice. The only 2 times I heard from them was after a news story ran where I talked about the drug company and what they did in June and July of 2021. And then the other one was November of 21, when another reporter reached out to them asking them for a statement on my complaints that they abandoned me. And the second time they reached out, they offered me a settlement of $1,200.
$1,200.
Yeah.
That's crazy. And that was directly from the pharmaceutical company or the testing?
That was actually from the drug company. And they misspelled my name in the email.
Right.
And
So
it was
insulting. But at least that, I guess that's part of your lawsuit. You could bring that up, that they were accepting responsibility by offering $1,200. Have you had any pretrial stuff yet? Has it gone to trial? When are you expecting?
Yeah, so we've had 2 trials. They're appealing the lower court's decision that said that this case can move forward. They're trying to hide behind the PrEP Act as well. So now it's sitting with the 10th Circuit Court of Appeals.
What state?
Huh?
What state is it in?
It's in Utah.
Utah. So is that a good court, do you think, for a case like this in your favor?
The state court was great. The appellate court, the 10th district, it was in Denver, and that hearing was very different. So
Colorado?
We'll see how that goes. But
hopefully it goes to the Supreme Court.
Yeah,
I would hope that it would, because I think we have the right justices now that would hopefully overturn that. And a lot of people don't know, and I'll just say it straight up, that it was Ronald Reagan, the great Republican president that everybody likes to use as an example of a great president, that was the one that signed this into law, the PrEP Act.
Well, so Reagan signed in the Childhood Vaccine Act, which provided the initial legal protection for all vaccines, and that was in 1986.
The Child Vaccine Act. Okay.
Yeah. And the PrEP Act was passed in 2005 in response to actually the 9/11 attacks. And so they wanted to allow companies to move faster in the case of emergency. And what they did in that case is they allowed government officials, healthcare professionals, companies that move quickly during an emergency to not have to think about the harm that they could be causing.
So wait, what year was this? This was in 2000 what?
2005.
They passed the PrEP Act in response to 9/11. What does 9/11 have to do with pharmaceutical companies?
So I guess like some of the excuses that these big corporations were using to not move faster when they were trying to do everything after 9/11 was they're like, well, we might get sued. So we're not going to move fast because we need to make sure that we're doing things safely and responsibly. So the government decided, well, forget safety. Let's just put something in that we can officially.
So
and one guy just puts in the PrEP Act. And
what was added into the PrEP Act that made it even stronger, the immunity from injury for childhood vaccines? What was added in the PrEP Act?
So the PrEP Act, for example, when the COVID vaccines came to market, the PrEP Act was instituted to provide the broad immunity beyond the childhood vaccine schedule.
So the immunity that was created by Ronald Reagan and the Congress back then was just for childhood vaccines?
That's like the starter kit.
The childhood
and then
vaccines.
the PrEP Act is like
that made it for all vaccines and pharmaceuticals, or just vaccines?
Emergency products. So
Emergency products
is protected under the PrEP Act as well. COVID vaccines are protected under PrEP Act. The ventilators they used during COVID was protected under the PrEP Act. So there's a whole lot of things that are protected. Yeah.
Freaking fascinating.
Yeah. So like the hospital protocol victims, they fall under the PrEP Act. So they also are in the same situation that the COVID vaccine injured are sitting, where they can't sue anybody.
It's just mind-boggling that that was a ramification of 9/11, like so many other things, like loss of privacy, the Patriot Act, and then the PrEP Act. I didn't know that. I thought it all traced back to the 80s with Ronald Reagan. So thank you for informing me of that. I'm definitely going to look more into that. But you met with Senator Johnson today. Tell me why and how did that go?
So we met with Senator Johnson to kind of go over the cover-ups in the clinical trial data. My case was not reported correctly. Neither was Maddie DeGarry. Augusto Rue, also another clinical trial participant, not coded correctly, right? So there's several things that the drug companies did from the beginning to kind of set them up for this obscene level of success that really should not, they really should have a little bit more of a fair balance of benefits versus risks, right? Instead of it's like benefits, no risk. So that's the first thing. And we also talked about the stuff that he unearthed with his previous hearing with Peter Marks, who's the in biologics at the FDA. And he talked about how Peter Marks was getting several safety signals flagged by his internal team that he then systematically shut down, so much so that he was telling them to cease and desist. Now, these are severe adverse events like pulmonary embolism, sudden death, cardiac death. These are fatal. These are not, just some little soreness at the injection site or dizziness, right? These are things that take people down. The reason why we're so invested in this is because we met with Peter Marks several times over a year and a half, beginning in 2021, and he was telling us the same thing. So he was lying to us to our faces when I'm so sick that I'm still laying on my couch having these Zoom meetings.
Peter Marks, just tell our audience who Peter Marks is.
Yeah, so he's the vaccine director. He was the vaccine director at the FDA. So he's the guy.
In the Biden administration or in the Trump?
In the Biden administration.
Was he there with Trump 1?
I actually don't know when he came in, but I do know that in the time that we met with him, he was responsible for licensing the vaccines, and he also was responsible for identifying the adverse events to the vaccines, which the latter he did not do. So he was lying to us the entire time when he did know about these adverse events. So we were
Is he named in your lawsuit? No, he's protected, I guess, by the
protected
after 9/11 PrEP Act.
Yep.
So he lied. Has that been revealed in Freedom of Information Act requests? How?
That's actually what that's what Senator Johnson was able to unearth with the 11 million pages of documents that he got out of HHS thanks to Bobby Kennedy.
So they released it to Senator Johnson as part of his committee investigation?
Yep.
Wow. So those emails showed this Marks person admitting that he knew there were injuries and
yes,
he covered them up.
Yes, exactly. So it's a clear.
And how come he hasn't been indicted? I'm just wondering.
Exactly. So that's what we're trying to work on. Peter Marks.
Peter Marks.
Yeah.
Hasn't been indicted.
And of course, that requires the DOJ to get involved. And so hopefully
the PrEP Act protects civilly and not criminally, from what I understand. So
somewhat, but it protects up until willful misconduct and or fraud. So you have to prove fraud.
Or if somebody was aware that it was dangerous, like you can't, like I'm assuming that the, what's the word? I'm assuming that the immunity only applies to mistakes. Like if somebody actually knew something was dangerous, they don't get immunity, I would assume.
There's one fine line in the PrEP Act legal code, and it says if the benefits outweigh the risks. And I think that's
then they're allowed to lie. They're allowed to lie. That's so crazy.
That's the part of that one line in that law is what's making this completely impenetrable for all of the families that have lost loved ones from the vaccine.
You know who was the congressperson at the time or a senator that was responsible for first co-signing that law?
I actually don't.
Yeah, we should find that out. We should just say to know. And if it was a Democrat or Republican, it was probably had to have one on each side, and they co-signed it. And what the makeup of the Congress was then, that's just crazy. I wouldn't put it past either party. I wouldn't. But now moving forward, what are you looking to in the future? I know that Senator Johnson's having more hearings. He doesn't plan on stopping Senator Ron Johnson from Wisconsin, who's one of the only members of the government that's still fighting for the vaccine injured. So we really do thank him for his work on that. What is the plan moving forward?
Well, we're trying to work outside the system because we know the government system is just continuing to fail, right? So Senator Ron Johnson, he's our champion. He's been our hero since the beginning. And outside of the system, this is where we really need everyday Americans to see what's going on, to reach out to React 19, see how you can get involved, donate if you can, because there is no corporate sponsorships. There's no pharma sponsorships coming to help support this patient advocacy group. It's very grassroots. And like I said, the money that we bring in, we put out into these medical grants for people so they can get their lives back.
Right. I know for me, even just like, for example, if I go to CVS and they do start selling me the vaccine at the counter, or when you even just call, I get triggered and I'm not vaccine injured. Is it triggering for you when you like literally just go into a pharmacy and they're still pushing COVID-19 shots 5 years later, knowing everything that's been done?
Yeah, and I'm a regular at the pharmacy now because of all the medications I'm on because of my injury. So, but I mean, we're living in an Orwellian time.
Do you ever tell them? I would tell them to put in the file because I told them put in my file, never ask me that again.
It's not even worth my energy at this point.
It just makes me so angry when it could.
Yeah.
You have to wait on hold, and it's like you have to listen to all the recordings about the vaccine. That's how better about COVID-19 vaccine. And I'm just like, just puts me in one of the worst moods.
Yeah.
So there is what you were saying.
Money goes into promoting those. So.
Right, a lot. Living in Orwellian times is for sure. Why do you think people are continuing to take these shots even though COVID-19?
The uptake is actually really low. It's like it's below 15% now
Of people that
in the US that are still getting them.
And why do you think that is? Do you think people actually woke up to the fact that this is BS?
I think people just experienced their own scary responses to it. Like if you talk to people that are even like, for example, the Utah Department of Health vaccine director, I talked to him in 2021 and he was like, wow, I didn't have your type of reaction, but I was still the sickest I have ever been after my COVID vaccine and it scared me to death. And he said, so I'm done having them. But then he's still promoting them everywhere he goes. But that I think it's
pretty selfish
more
and
personal for
right?
people on a daily level right now.
Because everybody knows somebody that was hurt by it at this point.
They do, yeah. And so I think once something hits your veins that upsets your body at that level, even if it does resolve, you're not going to want to go do that again.
Right. And I think that everybody sees that their friend that decided not to get the vaccine is fine and they didn't get the vaccine. And I also, know from my personal experience, I have friends that, have said they'll never get it again. And they might have had 2 or 3 of them, but then they had a really bad reaction or realized it was dangerous or finally woke up. But I have some crazy friends I have a friend that told me getting the second vaccine, he felt like it was closest he ever felt to death. He thought he was going to die. And then he got the third one.
Yeah.
So it's like some people, they just don't learn. It's insane. Like they're just so susceptible to this propaganda and this sense of, I don't even know what it is. It's like, they feel like they're some sort of saint or angel because they're getting the vaccine to protect others. And in reality, they're just harming themselves and others because the first time I got COVID was after spending time with my friend who got the vaccine that day.
Oh.
And she said, I think that's the only explanation because she wound up getting really bad COVID.
Yeah.
And I wound up getting it for the first time because we were sharing pizza and a Diet Coke.
Right.
And, I was enraged when I found out she had the vaccine that day. I'm like, thanks a lot. But then I was okay with it because I got immunity, which is, I think, the way it was supposed to be, that we just got immunity from actually surviving COVID, which was like a flu. Right now, it's the hantavirus and all of these other ailments that I feel like they just tested out in the media. They put a little peppering on social media and into the news, and they want to see people's reactions. They probably read the comments or do some sort of sampling and see, is this scary enough to get everybody to rush out and roll up their sleeve and get another vaccine? So this could happen again. This could happen under any administration, especially I think if the administration turns over in 2028 and Democrats come in, they know this is the playbook. They know that their audience loves to be afraid and turn to the government to solve all their problems. So in closing, what would you say to people watching, and how important is it to keep having these conversations so that what happened during COVID-19 when it came to the forced injections, the dangerous injections, never happens again?
You keep your mind open, don't fall for it again, because they will do it again. And that's what's nice about being on this side of it, is our eyes are wide open now, and we won't be duped again. So
I think so. I think a lot of people have woken up, and hopefully they continue to stay awake, because fear does strange things to different types of people. Some people face the fear, some people run, some people sort of just follow what they're told to do. And I think that was what sadly the majority of Americans did, but there were people out there fighting very hard. So thank God for those type of personality types. I think they say Robert Kennedy has said that it's 33%. I think he has something he always talks about, that it's always 30% of the population that will realize when something's wrong. And it's those 30% of the people that really turn out to be on the right side of history. So thank God for them. Where could people learn more about React 19 and help out?
Well, they can go to react1919.org. So it's just REACT19.org.
And is there social media accounts they could file?
Yeah. So they can look on just react19.org on Instagram, Facebook, X. TikTok doesn't like us, but you can find us on these other channels.
And are you on social media as well? People want to follow you?
Yeah, I'm on social media as well, so people can find me there as well.
Spell your name.
Bree Dressen, so BRI Dressen, DRESSEN.
All right, so people follow Bree and pray for her lawsuit, that there will be some sort of accountability for what she went through and what so many people in America went through, and can go through again if there's not accountability when it comes to these shots, injections. We don't call them vaccines. Thank you so much, Bree.
Thank you.
When you need medication, why does it have to be such a hassle? You call the doctor, you wait days for an appointment, sit in the waiting room, then you stand in line at the pharmacy, and sometimes they don't even have what you need. That's why me and my family use All Family Pharmacy. You go online, you choose what you need, you fill out a quick medical form, and a licensed doctor reviews it. If approved, your medication ships right to your front door. That's how it should be, and that's why you need All Family Pharmacy. Go to allfamilypharmacy.com/Lindell. Use code Lindell10 to save 10% now.
Hello, everyone. Allison Steinberg here with Lindell TV. We are joined by Congressman Marlin Stutzman, who represents Indiana, and we're so grateful to have you here, Congressman. Thanks for being with us today. I know you have been hard at work. You actually just came back from Israel, and you have a new resolution that you've introduced. You had a conversation with Benjamin Netanyahu about it. Tell us what this is all about.
Yeah, well, first of all, Israel is our greatest ally, maybe not just in the Middle East, but maybe even in the world. For a long time, Great Britain and other European countries were our best allies. But when it comes to fighting terrorism and dictatorships and totalitarianism, Israel has been there and fighting on the front lines. And so one of the things that I noticed, and as we talked about how Israel continues to grow, their economy is approaching $1 trillion as GDP, 10 million people living in Israel. Prime Minister Netanyahu made a comment on a 60 Minutes interview a couple of weeks ago that when the next memorandum of understanding comes up between the United States and Israel, that he wanted to move away from the supplemental that we give to them of $3.8 billion. Now, a lot of that money, they just turn right around and they buy equipment from us. They pay for different products and services that the United States provides. But he said, we want to stand on our own 2 feet. We don't want to be seen as dependent on the United States. And so when I was there last week, I mentioned to him, this is the direction that I agree, and I think a lot of people in the United States would agree with as well, that we want to be true partners. We don't want to be seen as, enabling Israel if there's a disagreement or anything like that. And I think it's also important that we do it under friendly conditions with President Trump as president, with a Republican Congress, before, a Kamala Harris or another Joe Biden comes along. That would make it difficult on Israel, and they might use that money as leverage on them. And so we want to stand together as true partners, and a trade agreement would replace the MOU, and so we're calling it aid to trade.
Okay, that's really interesting, and I like this concept. I think it's good, and I think a lot of Americans might be interested in this as well, because I think there are some concerns that, as you mentioned, we're just, giving them all this money and we should be more of a partnership. Do you think that's going to help quell some of these concerns amongst the American people at all?
Well, I think it should. I mean, there's a lot of frustration about foreign aid, and I hear about that a lot from my conservative fiscal constituents that say, why are we sending all this money to Africa? Why are we sending this money to Ukraine? Why are we, and then the Israeli question comes up, but it's more like, well, we know that Israel is our ally. But I think it's very noble of Prime Minister Netanyahu and the Israelis to say, we don't want to take it anymore. We want to develop a mutual relationship. And so I think that, if you're a budget hawk, which I am, I like the idea of saving $3.8 billion a year for the U.S. Treasury and the U.S. taxpayer. If you are pro-Israel, you're going to support this because of the benefits that come not only to the Israelis, but also to the United States in the private sector. And if you're anti-Semitic, you'll probably find a conspiracy theory to oppose it.
That's true. They always seem to find something, don't they? But I think it should. I mean, for all of the people who are anti-Semitic, which is on the left and the right, I will say.
Sadly.
I think this is a good path forward that sort of appeases everyone here. So I really like this idea. So how was this received by the Prime Minister when you spoke with him?
Oh, very well. We had sent it in advance. That way he could see the language, and his team was very receptive. He said, this is something that he's been wanting to do for a long time. I think it just shows the maturity of the country of Israel, that they have come so far. And, I often think of the Old Testament story of Nehemiah when he went back to build the walls in Israel, and he had to have a sword in one hand and he was building with the other hand. And so it's kind of what Israel has had to do to rebuild the country there. And it's incredible how much growth is going on there. And they're doing that while being attacked from all sides. And so they were very receptive to it. We're trying to build support for it in Congress. Obviously, the president and the Secretary of State will negotiate all the final details. But even Ambassador Huckabee came out with a post earlier this week saying that the next MOU with Israel would not have any aid in it. And so it's showing the maturity of the relationship.
Very good. And then what has the support been like amongst your colleagues here in Congress?
Good. It's been good. It's kind of, in the Midwest, we always say it's like a calf looking at a new gate. They're not sure exactly what to make of it. Like, Is this for real? Is this good? Is it bad? And but we've been actually getting a lot of good reception. Once people read the resolution and understand this is not a defund Israel effort, which that's what the Democrats would do. They would want to take the money away from Israel to hurt them. We want to build it and not send the money anymore in place of defense agreements and replace with trade agreements. And that way it'll continue to help Israel grow and build rather than it being a negative. And so that's what the Israelis want, and I believe that that's what a lot of my constituents, they would appreciate that Israel's not taking advantage of us, which I don't think they are, but some people would like to say that Israel controls us or that we control Israel, vice versa. And it just shows that two countries are standing independently together for freedom and democracy around the world.
I like it. Well done on that. Thank you for doing that. Since you mentioned Democrats, if it were up to them, they would probably, abolish all funding to Israel.
Yeah.
I have to use that as my little segue now to talk about ICE, because if it were up to Democrats, they would abolish ICE too, right?
Yeah.
And we need to protect our homeland. It's of the utmost importance. ICE specifically and Border Patrol have been unfunded now for 70 plus days at this point. Well, no, it's been since the last,
Shutdown.
I can't even keep track of it.
Right.
DHS is the bulk of DHS is finally funded, but ICE and Border Patrol are still unfunded, and it seems like there's no end in sight. Now, I know this is mainly an issue of the Senate at this point in time, but what on earth do you have any insight on what's going on over there?
So Secretary Mark Wayne Mullen, head of DHS now, came and spoke to us for lunch on Wednesday. And he just reminded us again. He's like, he said, I'm not blaming House side because the House has we've done our job on the House side. But he said, we are still defunded at DHS and several of the agencies. And, this is the Democrat Party always used to be the party that never shut government down. I mean, that was just something they would refuse to do. They would spend money into oblivion to keep the government open. And in this case, they're shutting down an agency that keeps Americans safe. They defend illegals in this country rather than defending citizens. And Mark Wayne said that a very staggering statistic is the fact that suicides are going up with agents that work for the department because they're not getting their paychecks. It's a difficult job. They feel like the sentiment is against them. And so I think that's something, too, that we need to consider, that there are people working for us as citizens to keep us safe, and Democrats would rather take their paycheck away from them.
Yeah, it's extremely concerning. And I think what's even more disappointing is that Republicans are almost caving to the demands of the Democrats at this point in time by keeping ICE unfunded, right? They have got to get this funding. They've been having to dig into the big, beautiful bill for funding, but that was actually intended for additional deportation measures. And all of that's just sort of halted now because of the lapse in funding. We saw this horrible incident over at Delaney Hall with, Democrats fighting harder for criminal aliens than actual American citizens. And then the leftists are so brainwashed. They're like biting ICE agents, which is probably contributing to that uptick in suicides that you just mentioned.
For sure.
I mean, where do we go from here? How do we get a handle on this?
Well, this is where I think that Senator Thune and the senators need to realize that the filibuster rule that they hide behind, that's all I can say, is what's keeping them from passing funding for DHS. Republicans could say, we're going to bypass the filibuster rule, the zombie filibuster rule, because we only need 51 votes in the Senate to move past the filibuster. They could change the rule. This is just a Senate rule, and they could pass funding for DHS today. But President Trump has asked them to abolish the filibuster vote. I think they should at least abolish the filibuster vote on budget items. Maybe if they want to keep it for other things, that's fine.
Yeah.
But it's being misused, and ultimately, who's paying for it is the American people.
Yeah, they always say that, it's a longstanding principle within the Senate to uphold the filibuster, but it's not even being used the way it was intended to.
Exactly.
That's such a great point. Gosh, I don't know how much longer we have to wait. I don't know what the timeline is looking at. They were promised us June 1st it would be done with a reconciliation because they're having to move to reconciliation to get this funded now. Obviously, June 1st is long gone. So do you have any insight on what the timeline looks like? I know that weaponization fund was sort of a holdup for a moment. They were trying to shove that in. That's no longer happening, but any insight on the time?
I support that weaponization fund because I have constituents, and we all know people related to this show that have been targeted by the federal government, and the DOJ was weaponized against American citizens. I have constituents in my district who have been, they were targeted under the Biden administration, and the investigation is still ongoing. This is a small business. This is not a big corporation with millions and millions of dollars. This is a $5 to $10 million company, and they're being buried by the DOJ and the investigation through HHS. And so I support that fund. I think that senators need to realize that the Republican primary voters are standing with the president. We're seeing that in primaries in Indiana, in Texas, in Louisiana, in other states around the country, and that the Republican primary voters want us to fight. And, they want us to stand on our principles, but they also want candidates who are going to fight in Washington. And that's what President Trump has done, and that's why he has so much support across the country. And I think if they don't want to change the rules in the Senate, we're going to have some new senators coming in that are supposed to support changing that filibuster rule.
That's right, and that just goes to show how powerful President Trump is, how much support he has from the American people, as much as Democrats love to try to malign him and make you all think that, he's some sort of a dictator.
Right.
The American people will strongly back the president, and his endorsements do matter. So there's that. As far as the weaponization fund is concerned, though, I know, as you mentioned, many people have been targeted by a weaponized DOJ, namely under the last regime, as I like to call it. Is there anything that can be done to right those wrongs? Now that a judge ruled that the weaponization fund was not to go forward, the administration said that they disagreed with that ruling but would abide by it. So what happens next? Is there anything that can be done?
Well, this is not the first time for a fund like this. President Obama created a fund like this as well when he said that there were constituents that were being targeted by the federal government. So this is not a new fund, but it does have to have approval from Congress. And so my hope is that we get it into a reconciliation package that only needs 51 votes in the Senate. And I tell you what, we need the Senator Tillises of the world, the Senator Cornyn's, who was defeated in a primary. We need them to stand with the American people. Don't go out bitter. Don't go out trying to poke the president in the eye as you're leaving the Senate because you lost. You know what? Don't be a sore loser, and really realize the reason people sent you here was to stand with the American people, and the American people are the ones that voted in those elections and saying we wanted you to fight. And so hopefully they can go out showing the American people that they were here to fight and do the right thing, standing with the president.
Yeah, they've betrayed the American people for the decades that they've all been in Congress, so maybe they could go out on a high note and actually work for us at some point. That would be nice. Well, Congressman, we appreciate your time. Any other items on your radar, anything the American people should be focused on or paying attention to?
Well, I mean, this is election year, and elections matter. Republicans have always been better at policy rather than politics. Democrats are so good at politics, but if we are not smart, and that's where the redistricting factor came in, that we have to be smart about redistricting. We have to fight back. Look at New England. There is not a Republican district in New England. They've gerrymandered those districts so badly, those states. And so President Trump is leading the fight, and we need to stand together. We need to stay unified as conservatives and as a Republican Party. That's how we're going to win, and we're going to continue to turn the country around.
I'm excited to see it, and I know you are too, and we're so grateful for all that you're doing to help contribute to that. So thank you, Congressman Stutzman, and thank you all for watching.
Most people think water's just about filtration, but in reality, it's about balance. What gets removed, what gets left behind, and how the water actually behaves once you drink it. Well, many traditional systems focus on one thing, removal. Reverse osmosis, for example, strips water down completely. It may sound ideal, but it removes minerals that our bodies need. The Century Wellness System was designed with a different philosophy. It removes common contaminants like chlorine, fluoride, and PFAS while restoring key minerals like magnesium and improving alkalinity. It also does all this without tanks and without wastewater, and without requiring a complicated installation. It installs in about 15 minutes under your sink, so instead of overcorrecting, it brings your water back into balance. Please visit CenturyH2O.com and use promo code Lindell for 10% off your next purchase. Mike Lindell here. The radical left and the deep state aren't just coming for our freedoms, they're coming after our money too. For years, they've been destroying our economy from the inside out with reckless spending, open borders, woke policies that crush our businesses. And now they've left us with an inflation disaster that's wiping out the savings of our hardworking families. They don't want us to be independent. They want us to be dependent on the government. Well, that's not going to happen on my watch. That's why I partner with American Independence Gold. It's a veteran-owned company that's helping patriotic Americans fight back by protecting our savings with real physical gold and silver. And right now they're giving away up to $15,000 in free silver and a free gold IRA kit. A portion of all the profits go to 9/11 first responders and veterans at the Tunnels to Towers Foundation. The deep state can't touch your gold, so visit MikeLindellGold.com or call 844-714-4653 right now. That's MikeLindellGold.com. Take back control. With everybody talking about making America healthy again, I thought today'd be a great day to talk to all my fellow patriots about the importance of making your homes healthy again. Well, we have proudly partnered with AirWaterHealing.com and their revolutionary whole home air purification system. The V3 from Air Water Healing does 3,000 square feet of purification. It eliminates dust, mold, viruses, and odors. But here's the part I love. They require no filters to ever be changed and virtually no maintenance. Whether you suffer from asthma, allergies, seasonal bronchitis, or just want to protect your family from the flu or even greater threats, don't wait to get your V3 from AirWaterHealing.com today. Use code Lindell for 20% off in savings and free shipping. That's promo code Lindell at AirWaterHealing.com.
When you read one news source, you get one side. When you read two sources, you get an argument. Read 40 sources, and you get the truth. LindellReport.com, the only place you ever need to visit for your news. From Lindell TV, over 40 trusted outlets in one place. No editorial gatekeepers, no hidden bias, Just the day's news, balanced, unfiltered, ready when you are. Whether you lean left, right, or straight down the middle, this is where you start your day. One click, one feed, one truth. The decision is yours. LindellReport.com. The news you need, the balance you deserve.